Okay, welcome back. We'll pick up the story with glucosamine and methylsulfonylmethane, MSM. So MSM is a naturally occurring substance that's very, very rich in the mineral sulfur. And as I was saying, you need sulfur to stabilize cartilage, and it acts as an anti-inflammatory in a natural way. There are not a lot of human studies on MSM, unfortunately. You have some very good anecdotal evidence, and you have animal models that really demonstrate its efficacy. A 2009 experimental study showed that MSM in an animal study was able to reduce the synthesis of prostaglandin series 2, so that reduces inflammation, and reduce the synthesis of inflammatory interleukin 6, reduce levels of tumor necrosis factor alpha, a very powerful cytokine that produces inflammation, and also, like glucosamine, reduce the activity of nuclear factor kappa beta. So we'll eventually look at all these things inside the cell, but you're toning down or down-regulating these inflammatory cytokines and prostaglandin series 2. So the researchers say collectively, these results indicate that MSM inhibits liposaccharide-induced release of pro-inflammatory mediators in sort of mouse macrophages through down-regulation of nuclear factor kappa beta signaling. And we think that the same thing actually happens in humans. And MSM is also discussed in this very fabulous book on integrative medicine by Dr. David Reichel, a medical doctor, in the third edition, which I think was released in 2012. It's a fantastic textbook to have as a reference in your office. So we'll keep going. So as I said, sulfur acts as an anti-inflammatory. It has been shown in a lot of doctors who use MSM claim that it works well. Their patients report pretty good success with it as an anti-inflammatory. I like combining it with glucosamine. I think the two of them together produce a pretty good effect. But before we leave glucosamine, I'll just tell you there's some animal studies and preliminary evidence, preclinical trials, that suggest that glucosamine may also have application for Crohn's disease and ulcerative colitis. Some of the thinking is that, at least in animal models, that the leaking of blood into the intestinal tract, into the lumen in those conditions, Crohn's and ulcerative colitis, is partly due to lack of glucosamine synthesis. So glucosamine is also required to make the other proteoglycans that stabilize the basement membrane of blood vessels. So when you can't make that adequately, the blood vessels leak, and it's a very vascular area in the gut, and so the blood vessels allow hemorrhaging, and so you get blood and other contents leaking into the lumen of the intestinal tract, producing these antibody antigen reactions, and you get this inflammatory cascade. In animal models, you've been able to stabilize some of the Crohn's and ulcerative colitis with glucosamine supplementation, and some human reports, some case reports go like this. You have a person that has ulcerative colitis or Crohn's, and they also have some arthritic changes. They take glucosamine to try to reduce their arthritic conditions, and they say, my gut is actually doing better as well. So we have some of these sort of case reports that have surfaced in the literature that I thought I'd bring to your attention, just to keep your eye on this going forward. Also, as we get older, if we make less glucosamine, then we're making less of the proteoglycans that are required to make the basement membrane for blood vessels, and that means they can leak more easily, and it may predispose us to hemorrhagic strokes as we get older. And then in cancer studies, you need glucosamine also to make hyaluronic acid in the tissues of the body. Some of that hyaluronic acid is sort of the mortar between the cells of the different tissues. And if you then have less hyaluronic acid, it's easier for cancer then to sort of using its hyaluronidase and other enzymes to drill holes through through the basement membrane of the tissues and invade adjacent tissues. So sometimes, for example, prostate cancer will, rather than metastasizing through the lymphatic system, it'll actually directly invade the next tissue, which is the bladder. And so it sort of does that by secreting hyaluronidase and other digesting enzymes to break down the proteoglycans between the tissues so it can reach the bladder and then set up a new colony there. So animal studies show that glucosamine increases the thickness and density of that basement membrane by more hyaluronic acid synthesis, and it becomes harder for cancer cells to actually drill through sort of thicker concrete, if you will, harder to invade adjacent tissue. So these are preliminary things that are being looked at right now that may have application in the future for glucosamine as well on a preventative basis. So when you put all of it together, I really think that, especially for joint cartilage stabilization, that after age 40, people should consider, as I have done, taking a glucosamine sulfate supplement of maybe 500 milligrams a day, maybe 1,000 milligrams a day after the age of 40, to prevent joint cartilage erosion, which typically happens in 70 and almost 100% of people by the time they're 75 years old. This might be a way to actually decrease that destructive changes. So far in my body, it's worked out quite well. And if the person has osteoarthritis or cartilage problems already, or sports injuries that have damaged the cartilage, then the dose is going to be 1,500 milligrams a day. If they're over 200 pounds, the dose is 2,000 milligrams a day. That's the dosage. If they're on a diuretic drug, you also would give them 2,000 milligrams a day because they're going to wash it out at a faster rate. For younger athletes, the dosage would be, let's say it's a 12-year-old little baseball player who sort of tweaks his joint cartilage in his knee sliding into second base or something, then that would be 10 milligrams of glucosamine per pound of body weight. And then once the cartilage is healed, you would take someone young off the product. Only someone who's over the age of 40 would stay on the product indefinitely, according to the evidence that we have. Now, students who are really athletic and who train hard say, would it make sense for me to start taking a little bit of glucosamine at a younger age just to stop the wear and tear effects? No one really knows the answer. I mean, it's possible that might actually be beneficial. These are the side effects of glucosamine that we've seen so far. They're rather infrequent, but you need to know about them. It can upset the gastrointestinal tract, give people some nausea or some GI upset, but usually if you have it with food, that doesn't happen. Some people report drowsiness. I've never seen a patient yet that said that. Some people can get a skin reaction. These are people who have sensitivities to glucosamine, and they break out in a bit of a skin rash, and so they can't take it. The odd person will get a headache from glucosamine use, but again, very infrequent. This is not common. But more recently, we've seen that some people who take glucosamine, their blood pressure rises a little bit. It doesn't matter what form of glucosamine they take. Say, but glucosamine sulfate's causing it because it contains sodium. Glucosamine sulfate doesn't contain any sodium. It contains the mineral sulfur. And sulfur and sodium are two different entities altogether. There's no sodium in glucosamine sulfate, or in other forms of glucosamine. There's no sodium. That's not why blood pressure is rising. We're not sure why it's happening. And people that have diabetes or insulin resistance, sometimes their blood glucose starts to drift up a little bit when they take glucosamine. It's not common, but it can happen. And the thinking is probably that why this happens is that for the cell to start taking glucose and converting it into glucosamine, it already assumes that it has enough glucose for other purposes. And so if it thinks it has enough glucose for other purposes, it probably doesn't make as many insulin receptors. So you might get some insulin resistance in that case. But it's a very rare occurrence. But what it really says is that if a person starts using glucosamine and they've had a history of high blood pressure, or they're an older person, you want to monitor their blood pressure in the first couple of weeks to make sure that it's not causing an elevation in blood pressure. And if they're already a diabetic or a pre-diabetic, they should have their blood glucose tested on a regular basis for the first couple of weeks while they're on glucosamine to see if it's having any effect on their blood glucose level. It's not that high blood pressure or diabetes is a contraindication to the use of glucosamine. It just means that these people need to be monitored to see how they're reacting to it. So overall, these side effects, which don't happen very often, especially the GI ones and drowsiness and so on, these are pretty mild compared to the side effects of non-steroidal anti-inflammatory drugs that are often used in arthritic conditions. because non-steroidal anti-inflammatory drugs can cause internal bleeding, life-threatening, congestive heart failure. We'll look at this. They can also raise blood pressure, cause liver damage, and severe kidney damage, which a thing that we call analgesic nephropathy. So we'll look at that later. So glucosamine really is a safer intervention overall than many of the typical medications that are used. Some other concerns related to glucosamine that come up when you're having discussions. That is, can you use glucosamine in patients that have sulfa allergies or sensitivities? So because it's called glucosamine sulfate, people assume that if they have sulfa allergies, then they can't use glucosamine. But that's incorrect. They can use glucosamine. And that's because when you have a sulfa allergy, you're really sensitive or allergic to the sulfamides, which are sort of the early antibiotic drugs that were made. And also some sulfamides are found in preservatives. So you can be allergic to those things, but glucosamine sulfate doesn't have sulfamides in it. It has the mineral sulfur. No one is allergic to the mineral sulfur. There's sulfur in every cell in your body. You can't be allergic to the mineral sulfur. So people that say they have sulfa allergies, they can take glucosamine sulfate. That's not a problem. Now, number 2 talks about the fact that glucosamine is mined from the exoskeleton of shellfish. That's where it comes from. So when they extract that glucosamine from shellfish, they make a pharmaceutical grade that's completely pure, that has no shellfish allergies in it. But I will tell you that I have seen cases where people have extreme shellfish allergies, and they use glucosamine sulfate, and they've had some wheezing and some signs where they're reacting a bit to it. So I'm very cautious not to give it to people that have very severe shellfish allergies. I think that that's something you might really want to consider. And then once again, with diabetics, you simply just want to monitor their blood sugar in their first few weeks. And you also want a person who's older or a history of high blood pressure. You just want to check to see in the first few weeks that their blood pressure is not rising with the use of glucosamine. So this is a sample of a glucosamine supplement that also contains some anti-inflammatory agents. This is what I take. It has the glucosamine sulfate in each capsule, 500 milligrams, but also the anti-inflammatory quercetin. We'll talk about quercetin, bromelain enzymes, and also MSM. So that's what I've used over the years and used with patients and myself. And I think for prevention after the age of 40, you would consider a product like this. 1 capsule a day. Maybe by the time you're 50 or 60, you might be taking 2 capsules a day. And then if you have osteoarthritis already, then you'd give the person 3 capsules a day. If they're over 200 pounds, you'd give them 4 a day. If they're on a diuretic drug, you give them 4 a day. That's sort of the dosing that you would consider. Now this takes us into part 2. So we looked at sort of glucosamine and joint cartilage effects. And part 2 of the osteoarthritis story really goes back to what we discussed in Essentials of Nutrition and Metabolism, part 1, sort of the biochemistry of inflammation and the role of essential fatty acids and eicosanoids, prostaglandins. So we know that there are natural anti-inflammatory agents, and essential fatty acids factor into that. So do antioxidants and B vitamins and anti-inflammatory herbs. But I want to get started with sort of the essential fatty acid story first. So as you know, there's essential fatty acids found in food and supplements, these polyunsaturated fats. And once they get into the body, not only can they be used for energy, but polyunsaturated fats also can esterify the phospholipids in the cell membrane of our cells. And then every 5 to 15 minutes of our life, those fatty acids can be cleaved off by phospholipase enzyme and converted either into prostaglandin series 1, prostaglandin series 2, or prostaglandin series 3. And as you know, prostaglandin series 2 is the prostaglandin series that promotes inflammation. And prostaglandin series 2 is produced from the polyunsaturated fat arachidonic acid. So when you're eating a lot of foods that have arachidonic acid, like high meat products in particular, then you have more arachidonic acid in the cell membrane. It becomes prostaglandin series 2, And prostaglandin series 2 has a number of effects, all of which are very negative. It causes the cells to divide at a faster rate, so you get more rapid cell division. That can lead to cancer and more accelerated aging. In the cancer subject matter, we'll get more into that. The arachidonic acid also becomes it tends to encourage constriction of blood vessels, and so you have less blood flow to critical areas like the heart, and it forms thromboxane A2, as we talked about in the cardiovascular disease section, and so it causes platelets to become stickier. You can form a thrombus more easily in the platelets, so you get platelet stickiness. That's an increased risk factor for heart disease. And of course, prostaglandin series 2 promotes more inflammation, so in the arthritic model it makes it worse. And it can also make the person's skin drier, more scaly, and flakier, whereas prostaglandin series 3 and 1 have the opposite effect. So, in North America, diets are very high in arachidonic acid. And much of the Western world, where people are eating a lot of beef and pork, we have these higher amounts. And also, there's a lot of linoleic acid that's found in corn oil and sunflower seed oil, safflower seed oil, mixed vegetable oils, lots of linoleic acid. And as you know, some of that extra linoleic acid can become arachidonic acid. The requirement is about, for our bodies from day to day, we need about 1% of our diet to be from linoleic acid to prevent an essential fatty acid deficiency. Once you're over 1%, any additional linoleic acid is slowly converted to arachidonic acid, and so it just makes everything worse. So the solution, of course, is to eat lower animal fat products, chicken and turkey breast and fish, because it has omega-3 fats. And instead of those vegetable oils, using olive oil or canola oil or even peanut oil, which is higher in monounsaturated fats, seems to be a better idea to help suppress inflammation. So in contrast to prostaglandin series 2, as you know, prostaglandin series 1 and 3 have anti-inflammatory effects, and also have other effects on helping, we think, reduce risk of cancer and blood stickiness, and makes your skin softer and smoother. It has a lot of really positive effects. And so, the omega-3 fats are extremely important. And also, when you're looking at that cell membrane and the biphospholipid structure, when you have more omega-3 fats, the cell membrane is more fluid and the receptors work better. So all the cells of the body are functioning in a healthier way. So when you look at that structure of the phospholipid, again, there's that glycerol backbone. Here's fatty acid 1 and fatty acid 2, and then you would have the polar group. In this case, this would be phosphatidylcholine with that particular phosphate group, and that's a very popular, common phospholipid in many cell membranes in the body. So here it is again. There's the glycerol backbone. You have the polar head here, and then when one of the fatty acids is arachidonic acid, that arachidonic acid, when phospholipase comes along, it cleaves off the arachidonic acid, and then it'll convert it into prostaglandin series 2 eicosanoids. So it's coming from the cell membrane and the membrane around the nucleus of the cell as well. So once that arachidonic acid gets cleaved off of the cell membrane by phospholipase A2, cyclooxygenase, this particular enzyme, converts arachidonic acid into prostaglandin series 2. So it's the drugs that reduce inflammation, the non-steroidal anti-inflammatory drugs, they work by blocking cyclooxygenase. So, aspirin and Voltaren and indomethacin and ibuprofen and naproxen and Celebrex and other non-steroidal anti-inflammatory drugs, they work primarily by blocking cyclooxygenase. That's how important arachidonic acid is to the inflammatory process. And when you block that, you stop the conversion of arachidonic acid into these pro-inflammatory mediators, and you reduce pain and inflammation. But in the event that arachidonic acid gets converted to prostaglandin series 2, it makes these inflammatory end products, including thromboxane A2 here in the platelets, that make platelets very sticky. Remember that in white blood cells, arachidonic acid using lipoxygenase becomes leukotriene B4, which also promotes a lot of inflammation right here. And so as we see in the text above, cyclooxygenase converts arachidonic acid into prostaglandin series 2, and these anti-inflammatory drugs block that. And lipoxygenase converts arachidonic acid into leukotriene B4 in a lot of the white blood cells, including monocytes and macrophages. And we'll see in the autoimmune story that becomes very important. There really are no drugs that block lipoxygenase. And so in autoimmune diseases, we'll see, to stop this process, they try to block phospholipase A2 right here, and you do that with corticosteroid drugs like prednisone. In the world of natural medicine, phospholipase can be inhibited to some degree by omega-3 fats. And curcumin from the spice turmeric blocks both cyclooxygenase and lipoxygenase. So that's why curcumin is such a great anti-inflammatory. And also boswellia and ginger also block the lipoxygenase enzyme. And white willow bark extract and curcumin and ginger can all block the cyclooxygenase enzyme. So these are fantastic natural anti-inflammatory herbs. They're not as powerful as taking naproxen and indomethacin and aspirin and entrophin and Celebrex. But over time, with the right kind of dosing, they can slowly bring the inflammation down and make the person much more reliant on the need for these rescue medications so they can use those drugs less or possibly eliminate them altogether. And so in the essential fatty acid story, as we've seen before, remember that alpha-linolenic acid from flaxseed oil can slowly be converted through desaturase enzymes and elongase enzymes down to icosapentaenoic acid, and it's EPA that becomes prostaglandin series 3, also using cyclooxygenase and lipoxygenase. And that fish oil also has docosahexaenoic acid, which can backtrack to also become EPA to also make more prostaglandin series 3 to reduce inflammation. And that linoleic acid, if you ingest more than more than 1% of your calories through the day, your body will slowly convert linoleic acid down towards arachidonic acid, using the same enzymes, by the way, that convert linoleic acid into EPA. So if you put flaxseed oil into your body, which is high in alpha-linoleic acid, it will slow down the conversion of linoleic acid to arachidonic acid by stealing away some of this enzyme activity to make more EPA. That's why I like the combination of flaxseed oil with fish oil. You get the alpha-linolenic acid, the icosapentaenoic acid, the docosahexaenoic acid. You get these great effects here on synthesis of prostaglandin series 3. And remember that dihomogamma-linolenic acid, under the right circumstances, can become prostaglandin series 1, which is also very anti-inflammatory. So when you're taking borage seed oil or black currant oil, which is high in gamma-linolenic acid, it'll help to convert that into dihomogamma-linolenic and then into prostaglandin series 1. And antioxidants help to make that happen, like vitamin C and vitamin E and certain B vitamins and zinc are required to enhance that process. What you're trying to do is stop the buildup of arachidonic acid, so you're trying not to eat as many of those high-fat meat products, and to slow the conversion of linoleic acid into arachidonic acid and sort of get that conversion to move more towards prostaglandin series 1. And so that's sort of what this slide is implying, and we've been down this road before, so you're probably familiar with it, but just to review, alpha-linolenic acid from flaxseed oil is 18 carbons long, and the first double bond occurs between carbon 3 and 4 from the methyl group. The methyl group is also known as the omega group. And then icosapentaenoic acid found in fish and fish oil is 20 carbons long, and again, it's an omega-3 fat. And then docosahexaenoic acid is just slightly longer. It's 22 carbons long. So EPA can become DHA in the body, and DHA can become EPA. And of course, DHA the brain loves DHA. The retina needs DHA. And here's linoleic acid, which is an omega-6 fat, 18 carbons long. Remember, the first double bond now occurs between the 6th and 7th carbon from the methyl or the omega N. And here's arachidonic acid, our big villain, which is 20 carbons long, and again, it's an omega-6 fat. Linoleic acid can slowly become arachidonic acid if you over-ingest it. So I think you're clear on that. And just to remind you, if we look at these fatty acids, here's myristic acid and palmitic acid and stearic acid. These are saturated fats. These are just hydrocarbon chains. There's no double bonds. And it's myristic acid and palmitic acid that primarily raise cholesterol, along with lauric acid, which you don't see here, which is 12 carbons long. And stearic acid, although it's a saturated fat, it tends not to raise cholesterol so much, but it does still increase platelet stickiness. Then you see oleic acid, which is an omega-9 saturated, omega-9 monounsaturated fat that you find in olive oil. And then you see the linolenic acid that we talked about here, and we see the gamma linolenic acid, again omega-6. And we see arachidonic acid, and then you see alpha linolenic acid from flaxseed oil, icosapentaenoic acid, and docosahexaenoic acid. But these are the omega-3 fats, the first double bond occurring between the 3rd and 4th carbon from the methyl end or the omega end, just so you really remember what we're talking about when we're discussing these fatty acids. It's good to look at them again. And remember that the omega-3 fats help to increase the fluidity of the cell membrane, which is very important for its function. It's been related to help reduce the likelihood of postpartum depression in women. So I think it's just so multimodal in its effects. And when you have just saturated fats esterifying the phospholipids, it's very hard for nutrients to get into the cell because you don't have that fluidity. Whereas with unsaturated fats, you have much more flow. Nutrients can move in and out. Waste materials can move in and out of the cell. The cells are healthier. And the same is true with respect to even glucose moving in and out of the cell. You want to have these healthier fats so that you don't have a rigid, hard membrane and the receptors don't work that well. And so all of the function of the cell membrane is improved. And this is basically just showing the same thing. So as we start to summarize this around essential fatty acids, there's synergistic effects of flaxseed oil, borage seed oil, and fish oil. So the strategy is you want to have less arachidonic acid and less linoleic acid in the patient's diet, and that'll decrease the synthesis of 5 and 12 these leukotrienes that are the 5-lipoxygenase and the 12-lipoxygenase, leading to these end products. And also you're decreasing the synthesis of prostaglandin series 2 from arachidonic acid. And then you want to increase your icosapentaenoic acid, or EPA, from fish and fish oil because it competes with arachidonic acid for conversion to cyclooxygenase and lipoxygenase. So the icosapentaenoic acid, as it's forming prostaglandin series 3, is actually using up the cyclooxygenase enzyme and the lipoxygenase enzyme, so you'll decrease the conversion of arachidonic acid to prostaglandin series 2. So it's providing competition, and not only is it making more of the prostaglandin series 3, but it's inhibiting the conversion of arachidonic acid into its prostaglandin series 2 by using up the same enzymes. And icosapentaenoic acid derived prostanoids and leukotrienes also decrease proliferation and inflammation. And we think this is why aspirin has been one of the things that's related to decreased risk of certain cancers like colon cancer, because if you block cyclooxygenase, you're not making prostaglandin series 2, cells don't divide as quickly, so they make fewer genetic mistakes, there's less risk of cancer. So we think that omega-3 fats are doing the same thing by slowing down the rate of cell division through the synthesis of prostaglandin series 3. The cells don't divide as quickly, and it's linked to decreased cancer risk as well. And icosapentaenoic acid also inhibits phospholipase A2, so you're cleaving off less arachidonic acid in the first place, the same way that prednisone does that. omega-3 fats, fish oil in particular, icosapentaenoic acid especially, seems to decrease the phospholipase enzyme activity. And then, of course, docosahexaenoic acid from fish and fish oil can be converted back to EPA. And remember that DHA is required for brain and for vision and for increased IQ, for the healing of concussions. But because it can be converted into icosapentaenoic acid, it's also important to reduce inflammation. Remember that alpha-linolenic acid from flaxseed oil can help to slow the conversion of linoleic acid to arachidonic acid because it's competing with the elongase. It's competing for the elongase and desaturase enzymes that also convert linoleic acid to arachidonic acid. And alpha-linolenic acid is slowly converted to icosapentaenoic acid, which is great. And from one person to the next, that conversion rate occurs at a different pace. It depends on sort of the enzyme polymorphism that you've inherited that particular genetic phenotype. And dihomogamma-linolenic acid that you really increase when you take in borage seed oil and or black currant oil, because those oils have a lot of gamma-linolenic acid in them, and that gamma-linolenic acid then becomes dihomogamma-linolenic acid. And dihomogamma-linolenic acid, just like icosapentaenoic acid, uses cyclooxygenase and lipoxygenase to make prostaglandin series 1, and in doing so it competes with arachidonic acid as well. So now less arachidonic acid can use those enzymes to become prostaglandin series 2, and also it's going to then block the conversion of arachidonic acid into the inflammatory leukotrienes because it's also going to compete with lipoxygenase, and it's been shown to produce anti-inflammatory prostaglandin series 1. So this is a sample of an essential fatty acid supplement that I take. It has the fish oil in it at a high yield of EPA and DHA, also flaxseed oil and borage seed oil that's high in gamma-linolenic acid. It's 22% gamma-linolenic acid. I think for general maintenance for health, you might want to take 2 or 3 capsules of that type of a product every day. And when you develop arthritic changes, then you're going to need at least 3 capsules a day, possibly up to 6 capsules a day. And so the lifestyle approach to take then would be to, overall, in terms of essential fatty acids, would be to reduce your intake of arachidonic acid from high-fat meat products, and also dairy products contain inflammatory mediators. Those fats generate inflammation as well, but using a different mechanism. And use olive oil and canola oil, possibly peanut oil, in place of high, polyunsaturated fatty oils. Reduce your intake of alcohol and hydrogenated fats because they also encourage production of prostaglandin series 2. And you also need antioxidants and B vitamins and magnesium and zinc to help synthesize prostaglandin series 1 and series 3. That's been shown. That's why those enzymes are called cyclooxygenase and lipoxygenase. You hear the word oxygen in those enzyme names. You need antioxidants to help make certain prostaglandins 1 and 3 synthesis optimal. And so here's an example of a high-potency multivitamin, of course, with the B50 complex and 1,000 milligrams of vitamin C and 400 IUs of vitamin E. And also has the 1,000 IUs of vitamin D. We've seen this before, but the magnesium and the zinc and bioflavonoids, selenium at 200 micrograms, all these things work synergistically with essential fatty acids from flaxseed, fish, and borage seed oil to enhance the synthesis of anti-inflammatory prostaglandins. And that supplement with borage, flaxseed, and fish oil, I think, is really at the heart of trying to get these anti-inflammatory mediators generated. And finally, just so you know, gamma-linolenic acid precursors. The body slowly converts linoleic acid to gamma-linolenic acid. We talked about this. And conversion is greatly reduced with aging. So as we get older, we have a harder time making gamma-linolenic acid and dihomogamma-linolenic acid. And in diabetics, individuals with premenstrual syndrome, people with eczema, other inflammatory conditions, and in First Nations people and in African Americans, they tend to have a harder time making gamma-linolenic acid and dihomogamma-linolenic acid, so they really benefit from the inclusion of borage seed oil in an essential fatty acid supplement. So when we come back, we're going to pick up the discussion with the inflammatory cytokines and their role in the inflammatory cascade and what natural things can be done to help suppress the secretion and synthesis of these important inflammatory cytokines. So we'll pick that up in our discussion when I come back.